You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new breakthroughs in the treatment of gum disease. According to my first guest, no more bleeding gums, no more bad breath, no more puffy gums with the new advances in laser therapy. With us, we have Dr. Yetta McCullum. Dr. McCullum, welcome to the program. Let's talk a little bit about your specialty. You're a periodontist.
Yes.
And so what do you spend most of your days doing?
I save teeth. I'm the superhero for saving teeth. That's what I do.
Okay, good.
And so a lot of times I'm that second opinion after someone's been told, you got to lose your teeth.
Like your teeth have to go.
Your teeth have to go. And then the patient goes, is there anything else you can do for me, doc? They'll send them to me. And sure enough, I can save teeth that a lot of other dentists would just put X's on. So
you've actually been told, you know, people come to you and say, you know, my teeth have to go.
Oh, yes.
And their teeth don't have to go.
True.
And so what are you doing differently? Or how are you looking at it differently?
I look at it differently because I know what the body can do. I know the miracle of the body's ability to heal and regenerate itself. So I know what the potentials are. I know that there's hope where a lot of other dentists may not think so.
So moving on to today's topic, gum disease. And there's new treatment options. What defines it, or what are the symptoms?
I would say a person would notice bleeding of their gums.
All right. Like bleeding when? I mean, just
when they're brushing, when they're flossing, sometimes when they're eating.
A little bit when you floss?
Bad technique, yeah.
Okay.
But usually you shouldn't have bleeding when you're flossing. That's a sign that there's inflammation or infection.
And you're headed for?
Well, you're headed for possibly more inflammation, possibly bone loss, loose teeth. I mean, it's a long chain of events, but the early signs can be bleeding. It can be sensitive teeth to hot and cold.
All right.
It can be periodic swellings. It's amazing how many patients I get who have had abscesses in their mouth. Rinse with peroxide, do a little home remedy action. It works, so they figure they're okay.
Okay.
Not the case. It's a slowly sneak type disease. It can really go very unnoticed.
So when you say, so puffy gums?
Puffy gums, swollen gums. But because it slowly develops, a lot of times people think that this is just the way I am.
Yeah, okay.
This isn't a big deal. And it is.
So it's a matter of just getting in
early, keeping up with your dental care, and having a particular type of examination known as a periodontal exam, where the dentist measures around each tooth. That's really the only way to know.
Okay. Now, my original question of what is periodontal disease, I mean, we asked the symptoms, but you say it's an infection under the gum line.
It's an infection under the gum line.
And by the way, is periodontal disease the same as gum disease?
Well, we're talking different
Loosely?
terms. Yeah, they're lay terms. Like gum disease is a very broad topic. Specifically, scientifically speaking, you have gingivitis, which is just the gum tissues infected. Then you can have periodontitis, which means that you also have the loss of bone.
Okay.
A significant difference.
All right, all right.
It's an infection under the gum line that can progress to the loss of bone support around the teeth and then the eventual loss of the teeth.
Now, how big of a problem is it, by the way? It's the #1 way people lose their teeth? Is that right?
For adults, it's the #1 cause of adult tooth loss.
Okay.
The statistics are going to increase. There's a major study going underway that is going to show that the prevalence of gum disease or periodontitis is even more than what we thought. So I think that data will be coming out soon. I'm not sure when it will be published. I kind of got the inside scoop from the president of the American Academy of Periodontology, but the numbers are going to show that more people have advanced gum disease than what we once thought.
Okay, now the good news is, you say with this laser,
with
the right candidate, you can wipe it out. No more bleeding gums, bad breath, things like that?
Yes, I can control periodontal disease. I can't say that I can cure it, because it's a chronic infection. It can be well managed, just like people are walking around with well-managed hypertension, well-managed diabetes. I can help patients manage their periodontal disease, keep their teeth, have a healthy mouth, fresh breath, no bleeding, no swelling. I can minimize all of those symptoms.
Why the breath? How does gum disease or periodontal disease affect the breath?
Well, bacteria put out odors. foul smell can come from food that's stuck between the teeth that hasn't been flushed out.
Okay.
Bacteria create odors. We're all familiar with that. So when you smell a breath that's foul, it's from decayed, dead tissue.
Under the gum line.
Under the gum line,
Interesting.
above the gum line, on the tongue. I mean, yes.
Do you ever have spouses that drag the other one in because of that?
As a matter of fact, since you mention it, just
Okay.
this week, a wife told her husband to come and see us. He had advanced periodontal disease. He looked bad. He had missing teeth. And yesterday I saw him, and his wife is so happy. I mean, he has a new front tooth. His gum disease has been treated. I don't know who's happier, the wife or the patient.
So how do you do it? So his bad breath is gone? Like after a couple
It's a
of treatments?
lot better. Yeah. Oh,
All
yeah.
right.
After one treatment, one good treatment
With the laser?
with
I mean,
my laser.
What, you
yes.
zap these bacteria, or what
Well,
do you do?
kill the bacteria. You do a very deep cleaning, and then you allow the body to heal. So in one appointment, I can have a dramatic change on a patient.
What does the patient say? Okay, so his wife was happy.
The patient's very happy too. He feels good. He feels better about himself, and so it's turned out quite well, and
Okay.
it turns out well for everyone.
So gum disease at the top of the show. We talked
Yes.
about new breakthroughs. So this
Yes.
laser has changed dentistry.
It's changed
a little bit,
dentistry. It's
especially your
certainly
job.
yes.
So how is periodontal disease normally done, and how do you do it?
Normally, periodontal treatment is done in phases.
Okay.
The first phase is called scaling and root planing. Lots of people have that. It's a deep cleaning where they scrape off the deposits. Some patients call it, oh, yeah, I've had my teeth scraped. That was done about 3 years ago. So that's the first step. It's that second step that people say no to. It's a surgical procedure where I peel the gums back away from the roots and the bone.
All right.
And regrow the bone by adding bone. I cut away gum tissue, and that was not the most appealing of options for many of my
Painful, right?
patients. It sounds bad. Your gums are going to be peeled back.
But
You're
I mean,
going to have
you have to cut the
stitches.
gums.
You have to cut the gums. I did it for
Interesting.
20 years. People would accept the treatment. You end up with longer looking teeth. It's better than the active disease, no question about it. But it wasn't an easy sell. Not
Okay.
many people wanted
'Cause it was
that
painful.
phase.
But
Right.
that was the only way to do it in the old days.
That was the way that I would treat gum disease.
And that's the way it's being done nationwide for the most
Nationwide
part.
gum
95%
surgery.
of the time
yes.
at least.
Yes.
This painful surgery. And you do it differently.
Now I use my laser.
Tell me about that.
Well, instead of peeling back the gums as a separate procedure, I combine the laser with the deep cleaning.
All right.
So in one appointment, you're getting the teeth cleaned. The laser is passing right along the teeth, just walking around this thin fiber, maybe 3 hair width in diameter, is walking around the teeth, and it kills off the bacteria. It sets the stage for normal healing to become successful. The body is always trying to heal itself.
So the gums get
The gums
better.
get tight around the teeth. I can even regenerate bone around the teeth.
Okay. Okay.
I don't have to put in sutures. The post-op is a breeze compared to the other surgery. Minimal actually, when the patient leaves, there's this beautiful blood clot. Well, to me, it's beautiful. But
Okay.
there's this nice hemostatic clot that's present, and it stays in place, and it promotes this wonderful healing that can occur. So that's the way I do my surgery now.
Now, something interesting you told me on the phone. You said, Randy, I was at a meeting, a
Yes.
periodontal meeting, and they're showing
A live
the surgical
surgery.
procedures.
Yes.
And you said when you saw that, it was like ancient history.
Right, right.
Elaborate on that. What do you mean by that?
Well, I was looking at this wonderful surgeon, beautiful technique, and he
To
was
get rid of gum disease.
to
we
get
should
rid of
mention.
gum disease and to regenerate bone. So he made this beautiful scalloped incision. He removed this layer of gum tissue,
Infected gum tissue.
infected
Okay,
gum
okay.
tissue, and some healthy gum tissue. But he removed, this was standard of care. You would remove a layer of the gum tissue, and then you clean out all the infected gum tissue, and then you add bone in certain areas, and then you suture everything back together. And I'm sitting there, I'm admiring the surgery, while at the same time saying, I don't do that anymore. I don't have to do that. I can get the same result.
You said like ancient history.
Yeah, for me, I mean 4 years.
I mean, you can get the same result with a laser.
With the laser.
Without the cutting.
Without the cutting, without the suturing, without the bone grafting material, without the growth factors. I mean, there's a lot of stuff that periodontists have to help the body regenerate, but it's in a bottle.
Okay.
I use what the body has provided to heal. And it works out beautifully.
If it's as good as you say it is, why then why is it that not 100% of the dentists are doing it this way?
Interesting.
What's your take on that?
Well, I just finished an article that talks about adoption of new technologies. It's very difficult for people to let go of what they're accustomed to doing. So there's obstacles there. There's a financial obstacle. The laser is not a cheap...
It's like $100,000.
It's not a cheap piece of equipment. It really isn't. And then people like the way they do things. You know, they kind of identify with their method. And so it's hard for some people to change. In my world, I guess I'm an early adopter.
Okay.
So I'm willing to try.
So you've been doing this for
4 years.
For 4 years using the laser. You know, another thing, and I'm trying not